President Trump is getting ready to make deep cuts to Medicaid and food stamps to pay for a $4.7 trillion tax cuts. You've heard it in the news and it's now happening. I have all the details for you. This is really serious. It's going to impact seniors in significant ways. And I'm going to walk you through exactly what's about to happen and how it's going to affect your benefits. So, whether you are on SNAP benefits, which is food stamps, or whether you're on Medicaid, remember 50% of nursing home and senior care facilities are paid for by Medicaid. So this is going to hit seniors very hard. I want to bring you all the details and then stay till the end of this video. There is some good news about Social Security increase, the $360 increase that was passed into law recently that millions are going to benefit from. I have an update on when that check will start going out. If you're new to this channel, hit the like button, hit the subscribe button, because all we do is bring you the latest news and update, anything in and out of Congress that is going to affect your Social Security, Medicare, Medicaid, food stamps, and more. Now, as always, I want to know where you are watching this broadcast from. So go into the comment section. Let me know your city and state. If you're watching outside of the United States, let me know too. I want to know the country where you are watching this broadcast from. So let's jump right into it. But before we get started, let's talk about Medicare for a second. A lot of you have been telling me about your Medicare horror stories. I've read a lot of comments about some of you getting dropped out of your plans, your hospitals not offering services, or your Medicare plan, especially Medicare Advantage plans, being discontinued. And so many people are being impacted, and the care that they need is not there when they need it. And so this is what I'm going to tell you. We have a Medicare partner chapter that is offering a free, unbiased service to help you find the best Medicare plan. 90% of seniors are in the wrong Medicare Advantage plan, which is part of the problem. And there are 24,000 Medicare Advantage plans, and chapter has access to all of them. They are not working for commission. They don't pay their agents commission. And so the only goal is to help you find the right plan that fits your budget, fits your needs, and able to give you the healthcare you need when you need it. So call them on the number of the screen, 539-205-2147. They have been vetted. They have A+ rating with the Better Business Bureaus. These guys are the real deal. And here's the part that I like. They can save you $1,100 on average each year. So call chapter and get into the right Medicare plan. Now let's talk about Trump's billion-dollar cuts to fund the trillion-dollar tax cuts. Basically, they are making deep cuts into food stamps, into Medicaid, in order to be able to pay for these tax cuts that is skewed primarily to benefit the rich. What do I mean by that? Well, the first idea that is being floated around is the harvest box. If you haven't heard about this, you need to stay for this, because this one is a big one. So basically, Trump wants to turn part of the food stamps program into a harvest box, where instead of you going to buy food with your own EBT card, they are going to ship you a box of food that the government picks, shelf stable food. And that is the option that you're going to get. So a part of your food stamps program is going to be converted into this monthly box that the government is going to ship you. Where did this idea come from? Well, this is an idea that Trump has had before. When he was first president, he brought this idea in, and because Democrats were in Congress and in control of the House, they shut it down. Now Trump has the White House, and the Republicans have the Senate and the House, and now this idea is back in the news. I saw this a few days ago in this article about why and how Trump is going to really shape the food stamps program. And one of the ideas that was in there was this harvest box idea. I was so surprised that it's back in the news again. And basically, what it does is that previously, here was how he pitched it. The largest singular cut Trump attempted was to withhold a portion of benefits and instead provide recipients a box of non-perishable food. Under the plan, the government will theoretically buy the boxes at reduced cost compared with sending recipients their full benefit, and then the government will pocket the rest. There's going to require a lot of resources to do this, but this is the idea that is back in the news. And then I dug further and realized that it was even back in the news right after the election, because this was another article that says Trump's budget was envisioned much more sweeping cuts. His latest one will propose a 30% cut to the SNAP program, including a new work requirement on top of the already one in the program, and then a plan to shift a share of the program into a harvest box, a plan in which households will not only get to choose the food that they buy, but instead are sent a monthly box of shelf-stable food that the government picks. Now, this is something from the Center for Budget and Policy Priorities, and they're saying President Trump's previous budget wanted to cut 180 billion, and now he's back again, and now he wants to implement this, something he wasn't able to get done before, and they laid it all out. This was the plan he presented in 2021 that was shut down, and now he's bringing it all back. And a huge part of that $123.9 billion is to cut SNAP and shift it into food boxes where they will ship you food, So here's how it's going to work. As he did previously, he would take 40% of SNAP benefits issued to households and use half of those funds to give household eligible for SNAP benefits of $90 or more a month a box of non-perishable food. So if you were getting food stamps of more than $90 a month, it's going to take 40% of that and send you a box of non-perishable food such as shelf-stable milk, ready-to-eat cereal, pasta, peanut butter, beans, and canned foods. The box will be in lieu of the food that these households would otherwise purchase with the part of their SNAP benefits in the grocery store. Participants apparently will have no choice in what they receive. The government will pick everything every month and send it to you. The other half, remember, he's taking 40%. The other half of that money held back will be completely gone. So you're not get that. He's going to take that money and put it back in the government, resulting in about $120 billion in federal cuts over 10 years. This is serious business. And so another thing he wants to do is change how seniors get SNAP benefits. He's going to impose additional work requirements. The proposal will take SNAP benefits away from adults up to age 65 years old, including many children who are temporarily unemployed or working fewer than 20 hours a week. So if you don't work 20 hours a week and you're less than 65 years old, you are going to lose your benefits. He's going to eliminate the link between SNAP and energy assistance. This was something that if you qualify for SNAP benefits, you could get energy assistance. If you qualify for energy assistance, you could get SNAP benefits. He's going to eliminate that link. So if you're trying to get both programs, you have to apply differently, and the rules will be tightened so that he's going to make it harder for you to get these benefits. The next thing he's going to do is change the definition of what it is to be called an elderly when it comes to applying for SNAP benefits. So for example, the budget would change SNAP's definition of elderly to begin at age 65 instead of the current 60. As a result, low-income individuals between age 60 and 64 would no longer qualify for certain eligibility rules that apply to seniors and certain program flexibilities designed to reduce administrative burden and ease access for vulnerable seniors. So basically, he's going to make it harder for seniors to apply for food stamps. And the House Republicans are on board. This is Glenn Thompson. He's the chairman of the House Agricultural Committee. He's full lock and step with this. He wants to cut $30 billion over 10 years, and part of it is what I have shared with you as part of his plan. So here's what it's going to look like. Every month, they're going to send you a box of food with canned food and all these stuff that you get no choice in picking. They're going to pick it, ship it to you, whether you like it or not. And it's going to be called the Harvest Box. Now, when he was in office the first time around, he tried to do this, as I said. The Democrats stopped it, and now he's back again. And who knows if there's going to be any resistance in Congress, because the Republicans have the House and the Senate, and I'm very doubtful that they are going to stand in his way of trying to make these deep cuts to food stamps program to finance the tax cuts. So how deep are these cuts going to be? Well, let's look at it. So the House Republicans proposal calls for a $230 billion in cuts to food stamps over a decade. through the Agricultural Committee. This represents about 20% reduction in the program's current funding levels and will be the largest cut to food stamps in 30 years. So whatever food stamps you're getting right now, think about maybe 20 to 30% of it will be gone. Some of you will lose all of your benefits because they will make the eligibility requirements so hard that it will just knock you off the program. SNAP serves 42 million Americans, 1 in 5 children, and the program is crucial for working families, seniors, and disabled individuals who struggle to afford adequate nutrition. And so this is the plan. And what is all this for? Well, these cuts are part of the larger 2 trillion in reduction in mandatory spending designed to help House Republicans push through Trump's $4.5 trillion in tax cuts that will primarily benefit the wealthy Americans, requiring a $4 trillion increase in the debt ceiling. So who is going to be impacted by these deep cuts in the food stamps program? Well, over 42.1 million Americans receive SNAP. The program serves 11.6% of children under 5 and 28% of children between ages 5 and 17, making it a crucial part of families' nutrition plan. It cuts across the entire country. So it's going to affect people in Oregon to New Mexico to Oklahoma to Louisiana to Illinois to West Virginia to Washington, D.C. So this is not specifically to any particular region. It's going to affect SNAP beneficiaries and seniors across the country. For example, in Tennessee, there's 800,000 people that rely on SNAP benefits, and there are certain counties where 51% of people are in food insecure residents, meaning that they lack adequate food or nutrition. And this is going to be a very serious problem in those counties where a lot of people are struggling. And some of the deep changes is that they're going to shift the way benefits are calculated. They're going to increase the work requirements. They're going to push some more responsibility to the states. And then they're going to change eligibility requirements and make it harder for people to apply for benefits. So let me know what you think in the comments. Do you like what you're hearing? Do you like these changes that President Trump is trying to do or trying to implement so that he can fund his tax cuts for the rich? Let me know your thoughts in the comments, because some of you, when I share things like this in the news, it may not seem like it's real, but here's the thing. This is real, and this is the political environment that we're in, and they're determined to push this through. And so I would not dismiss it because this is happening in the news. You can Google it yourself and see what's happening in the news about food stamps cuts, about Medicaid cuts, about Medicare cuts. So I want to make sure that you're taking this seriously because these cuts are coming. And if you don't prepare for it, it will be a big surprise to you and your benefits when you wake up one day and your benefits has been cut deeply or it's completely gone. So I want to talk about economic implications. Who is this going to impact and how is it going to impact those people? Well, the average SNAP benefit is $6.20. And now that is going to go down further. Families are going to be struggling because of this. States are going to also be impacted, and it's going to take a lot of administrative work to implement these changes. But it's also going to affect local businesses because for every $1 in SNAP benefits that is spent, it creates $1.979 in economic activity for the state or for local businesses. It also stimulates the local economy, and 80% of SNAP locations, like retailers that accept food stamps, 80% of those are small businesses. So this is going to hit hard to a lot of small businesses. And here's the thing, this is all because of tax cuts that Republicans want you to push through that is going to benefit people who make $500,000 and above. They're going to get twice as more than 2.5 times larger in tax cuts than the average low income family. So this is primarily going to benefit the rich, and is going to increase the debt ceiling by $4 trillion and bust the budget and the deficit to be able to make this happen. So I want to hear from you in the comments. What do you need to watch for? March 27th, they're going to vote on this. It's going to come to the floor probably in the end of February. There may be some legal challenges. I don't know if they're going to be successful, but I'm sure they're going to try. States are going to try and block this. But with the current state of things, I don't know what the courts are going to do and whether the courts are even going to be willing to block this proposal. So if you want to take action, call your representatives, call your congressperson, call your senator. Make them aware that you don't like this and that this is not what you want done and that you don't want your food stamps taken away. You don't want your Medicaid taken away. Another thing they're trying to do is ban junk food. This is something that the governor of Arkansas, Sarah Huckabee Sanders, has been pushing to ban junk food in food stamps, and the reasoning is that it's supposed to save money and also promote health. And now he's trying to get Robert F. Kennedy Jr. involved, who is the Secretary of Health and Human Services, to also back this initiative to push junk food out of food stamps. Let me know what you think. That's the third change that is coming. And this is in full steam, is supposed to eliminate junk food completely and save $25 billion that is being used currently to buy junk food in the SNAP program. And then they're going to restrict states from having waivers and flexibility to be able to allow more people to get on food stamps. So states used to have a lot of flexibility that allowed them to be able to tweak the rules in times of high unemployment to offer SNAP benefits to those in need. Those are all going to be gone. And then they're going to tighten the work requirements to make sure that seniors up to age 65 have to work in order to get SNAP benefits, which was not the case previously. So a lot of changes are coming, but there's some good news. Summer EBT is going to stay. It's a permanent program now, and it offers $120 per child for kids that were getting the the school breakfast nutrition program and the school lunch program. So the kids that were participating in that during the school year, but during the summer tend to go hungry or do not have adequate nutrition, this program was created and is going to help 29 million children across the United States. So if you know somebody that is on food stamps, or you have a grandchild, or you have neighbors or your friends that have kids on the school lunch or school breakfast program, this is good news for them. Each child is going to get $40 a month. And so if you have four children, that's $160 a month to buy them groceries and nutritious food. So this is a great news. And then the final change that is coming is that states are going to be trying to prevent food stamp fraud, which has been rampant. Everywhere you turn, there is a news article about somebody losing their food stamps to fraud. And now you're going to see states issuing really debit card with chip technology that is going to help deal with this problem and help address food stamp fraud that is continuing to grow. So let me know what you think about these potential cuts to food stamps. This is devastating. It's going to be deep because they need a lot of money in order to be able to fund these tax cuts. And the easiest place they've started looking is food stamps. And so let me know your comments. What do you think about all of these things, these 7 changes that I've shared with you that Trump wants to make to the food stamps program? And then we're going to talk next about Medicaid cuts that are coming. And let me tell you this, a lot of seniors tend to ignore Medicaid. You need to pay attention to this because it may affect you, because Medicaid pays for 50% of all long-term care and nursing home stay in the United States. And a lot of seniors don't know that. Medicare does not do that for you. Medicaid is what supports low-income seniors when they need long-term care. So stay with me as I dig deep into the changes and the deep cuts that Trump wants to make to Medicaid and why you should care. All right, so now let's talk about Medicaid. Why does Trump want to cut Medicaid? Well, it's all part of the plan, the big plan to finance the tax cuts. So let's jump into it. So, what is the scale of these cuts? Well, the House Republicans have unveiled a budget proposal to cut $880 billion from the Medicaid program over a decade. This is going to really be a deep cut. The cuts are being proposed to help finance Trump's tax cut package, estimated to cost between $5 to $11 trillion over 10 years. The Republicans are targeting a week of February 24th for a floor vote on the budget resolution. The Senate is pursuing a different strategy with two separate bills, creating uncertainty about the final outcome. Medicaid currently provides health insurance to about 80 million Americans, including children, elderly and disabled, and low income adults. The program costs approximately $870 billion in 2023, making it the primary target of deficit hawks. There are 9 states that will trigger laws that will kick people off Medicaid if the federal government cuts benefits. States would need either dramatically increase their spending or reduce Medicaid services if the federal government cuts benefit. And hospitals and healthcare providers, particularly in rural areas that depend heavily on Medicaid for survival, any significant cuts will force facility closures and reduce access to care in vulnerable communities. And states will face increased costs and complexity in implementing new requirements, such as work requirements that are coming. So, what are the proposed cuts that they want to do? The first one is work requirements. Republicans are considering nationwide work requirements that will cost 109 billion, that will save 109 billion, but will cause approximately 1.5 million people to lose their Medicaid coverage. The requirements will primarily affect working age adults who aren't disabled or caring for young children. So this is going to include seniors. A proposal to limit federal funding based on population will save up to 900 billion over 10 years. This will fundamentally change how Medicaid is funded, ending the current federal matching system. The proposals could reduce the federal government's contribution rate to state programs, and this could save about 530 billion over 10 years. And then they plan to limit the state's ability to maximize federal matching funds through supplemental payment programs and save $175 billion. So why should seniors care? Well, Medicaid is a joint program between the states and the federal government that provides health care to low-income Americans, including seniors, disabled individuals, and children and working families. Unlike Medicare, which is purely federal and primarily for seniors, Medicaid covers a broad range of services, including long-term care and nursing home coverage that Medicare doesn't provide. That's why seniors need to care about this news. Currently, Medicaid serves approximately 80 billion Americans and costs 870 billion annually. Medicaid pays for essential services including nursing home care, health, home health aides, personal care services, and medical equipment that many seniors rely on daily. For many middle-class families, Medicaid becomes the crucial angle, the crucial health provider when their savings are depleted by long-term care costs that Medicare won't cover. And here's another interesting fact that a lot of people don't know. Over 12 million Americans are dual eligible for both Medicare and Medicaid, and most of them are seniors. And Medicaid, for those people who are dual eligible, pays for your Medicare premiums, your deductible, and services that Medicare does not cover. So why should it matter for seniors? Well, long-term care, that's why you should care about Medicaid. Medicaid is the primary payer of long-term care in America, covering 62% of all nursing home residents and being the only program that covers extended nursing home stay. Without Medicaid, middle-class seniors will be unable to afford nursing home care, which will cost about $90,000 a year. Another reason why seniors should care: home and community services. Medicaid provides crucial support that allows seniors to remain in their health home through home healthcare services, personal care assistance, and medical equipment. These services help seniors avoid delay or expensive nursing home care while maintaining independence in their communities. Family care support. If you have a family member giving you care, that could be paid through Medicaid. Medicaid helps support family caregivers through programs that can pay family members to provide care through respite care services. This support is vital for millions of families struggling to care for elderly parents while maintaining their own jobs and families. And then health safety nets for seniors who have exhausted their savings for paying for health care or never had significant savings. Medicare services serves as a crucial safety net, ensuring access to necessary medical care. The program often becomes essential when seniors face unexpected health crisis or when chronic conditions require extended care. So what are the proposed cuts? Well, they're going to cut $880 billion, and it could significantly impact seniors' access to long-term care and support services. More than half of all Medicare spending goes to the elderly and the disabled beneficiaries, meaning they will now have to bear the brunt of any funding reduction. It's going to affect states. It's going to affect healthcare providers, especially in rural areas. Medicare cuts could force many nursing homes and home health agencies to close or reduce services, as Medicaid is their primary source of funding. Rural areas will be particularly hit hard, leaving seniors in those areas without access to necessary care. And family financial impact. Reduced Medicaid funding will shift more costs to seniors and their families, potentially forcing difficult choices between medical care and other necessities. Many middle class families will face financial ruin when confronting long-term care needs that Medicaid currently covers. This is why you should care about the funding cuts. It's going to impact elderly and disabled. It's going to impact children. It's going to impact working families. It's going to impact rural communities. And even Steve Bannon, who supports the president, has joined U.S. hospitals to protest the cuts because he knows that this is going to hit hard broadly and is going to affect even people who supported the president because Medicaid serves 80 million Americans. It doesn't matter which party you're in, you know somebody who is on Medicaid or gets assistance from Medicaid, especially seniors and people who are disabled. So this is coming. What can you do? Well, you can call your congressperson because it's going to have a devastating effect on the healthcare sector, in the local state economy, the insurance market. Major insurance like Centene and Molina, which specialize in Medicaid managed care, will face significant business disruption. This could lead to market instability and reduced competition. Many local businesses also rely on Medicaid to provide health coverage for their workers. Cuts will force these businesses to either provide coverage or risk losing workers. So there are alternatives that Democrats are proposing, but Democrats are not in charge. And so it's going to take advocates, people to raise their voices, people to pay attention to the news and register their disapproval about what is about to happen to Medicaid benefits. And long term, it's going to impact seniors and people with disability and children the most. And maybe there's going to be a conversation about this in the 2026 election because once a lot of people get knocked off their food stamps, a lot of people get knocked off their Medicaid benefits, maybe this is going to trigger some action and a pushback. So let me know what you think about these Medicaid cuts because they are deep, they're coming, and the Republicans are determined to make these savings from Medicaid and food stamps to fund the big $4.7 trillion in tax cuts minimum that they want to pass to extend Trump's previous tax cuts and make them permanent. So let me know what you think in the comments as we talk about the last bit of good news, which is the Social Security increase through the Social Security Fairness Act. Now, if you've been paying attention, the Congress recently passed and former President Biden signed into law the Social Security Fairness Act is going to give $360 a month increase to some people, up to $1,190 for some others, and there's a lump sum component. So some people are going to get a minimum of $4,320 in lump sum payment that is going to start in March 2025. And some people are going to get as much as $14,000 in back pay that is coming. So if you like what you're hearing, hit the like button, hit the subscribe button. We appreciate your support. Let's get to it. So stay till the end of this video because a lot of you have complained when I did a previous video about this particular topic that you think is not fair that Congress passed this law and it's not applicable to everybody but just a section of Social Security recipients. So let's talk about it. So President Biden signed the Social Security Fairness Act is going to help over 3 million beneficiaries who will see their average checks jump from 1,976 to 3,166. It's been a 40-year battle, and this massive change will cost $190 billion. It's going to impact government workers in certain states, and it's going to be a huge boost to their benefits. So, what is this about? Well, the House voted 327 to 75, and the Senate voted 76 to 20. So, it has strong bipartisan support, and President Biden signed it into law on January 5th. And then the Social Security Administration is going to start implementing it now. Well, it affects two provisions, WEP and GPO provisions that reduce public servant benefits for 40 years. And this reform is going to affect 3 million public sector workers. And it started with President Reagan, who passed a law limiting people who are working for the government to get Social Security benefits if they're going to get government pension. And so, even though some people were able to work and pay into both and qualify for both, their Social Security benefits were either eliminated or reduced severely. So, what Congress has done is to support these public sector workers, government workers, and restore their full Social Security benefits, even if they're also getting a government pension. And so, if you were impacted by WEP, you're going to get $360 monthly. If your spouse or you have a spouse that was impacted, you're going to get $700 increase monthly. If you're a survivor and you were significantly denied your your deceased spouse's benefits, you're going to get $1,190 a month increase. And then on top of that, there's retroactive payments that is going to start January 2024. So what does the retroactive payments look like? Well, if you are getting $360 monthly increase, you're going to get one whole year in retroactive payments from January 2024 to December. So you're likely to get on average $4,320. If you're a spouse and you're going to get the $700 spousal increase, then your lump sum payment is going to be $8,400. And if you're a survivor and you're going to get the survival benefits increase of $1,190, then your lump sum payment is going to be $14,280. The Social Security is going to figure out all these things, calculate all the payments, and publish a timeline. But what we're hearing is that it's going to start, all of it is going to start late February and early March. Now, this has been a long time coming. And so those who've been waiting for it, your monthly increase will automatically be sent by the Social Security Administration, and then your back pay will also follow. And they have released a distribution schedule that is supposed to start end of February into March and continue through the year. If you have any questions about this, call the Social Security Administration, visit their office by making an appointment, or go online and check out their latest news updates about this topic. Now, a lot of you have said, okay, this is not fair. Even though some people are getting something they deserve or have been waiting for, why haven't they passed a Social Security increase that is going to help all Social Security beneficiaries? And I agree with you. But I want you to hear real voices of people who were impacted by this. This person says, some of us worked as firefighters, whereas I did not pay into Social Security, and then I also had a second job or business where I did pay into Social Security. As a result, I earned enough credits to earn Social Security benefits. When I started receiving Social Security benefits, I was initially told I will get X amount of money. And now, when he started getting his benefit, he was reduced by 60%, even though he was fully paid and eligible for Social Security just because he has a firefighter pension. And so, this is an example of people that have been impacted. This person says the government took $600 of mine from me since 2009 because of the GPO. I have given over $100,000 since I retired. I will never recoup that amount of money. I won't be holding my breath for any money, and so forth and so on. There are real people who were impacted by this, and for them, this is a relief. This is good news. And a lot of you are saying that this is not fair. So let's talk about it, especially when COLA was 2.5% and people are getting $40 increases. to watch somebody get $260 or $360 or $700 or $1,190 and up to $14,280 in lump sum payment, it can be very upsetting for a lot of people because I agree, maybe the government or Congress should have passed a larger Social Security reform bill that would increase Social Security benefits for seniors, especially the plan that has been on available and has been floated around to give seniors a $200 increase a month for Social Security benefits. That plan has been available for a couple of years now and is been pushed bipartisan to increase Social Security by $2,400. That's $200 a month, and that has not happened. But then Congress went ahead and did this. So I can understand why people are upset. Let me know in the comment section below what you think about this Social Security Fairness Act. Do you think Congress should focus on passing a bill that will benefit all beneficiaries? Let me hear from you in the comment section below. And I really appreciate you hanging with me this evening on today, talking about Social Security, talking about food stamp cuts, talking about Medicaid. I want to hear all your voices in the comments. If you have any information that supports, or if you have any other information that you're hearing about cuts that are happening, people who've lost their benefits, people who are about to lose their benefits, if you receive a letter, I want to hear from you. And continue to share your Medicare horror stories, because I'm trying to compile all these stories to understand the challenges some of you are facing so that we can find resources that can support you. For example, the free Medicare help that you can get from our partners, Chapter Healthcare, Chapter Medicare, that can help you find the best Medicare Advantage plan during this open season, which is a small window that allows you to change or switch your Medicare Advantage plan. So until the next video, until the next live, thank you for hanging with me, and I will see you soon online.